explain to me what your symptoms were before you had your procedure?
You have to understand that I hadn't been to a doctor in 35 years. I know that's not good press, but that's the way it was. I'd always been what I considered to be reasonably healthy until the past 2 years. And I was very lethargic, no energy, and it kept me for about 6 months almost bedridden. I had had an MRI on my lower extremities and my lower back, and this was missed because of the location of the aneurysm. And when I went in complaining of a stabbing pain, which was unlike anything that I'd ever felt at that point, through emergency at Good Samaritan, they did another CAT scan, and only this time trying to focus on what they thought were kidney stones. I had been sent to Dr. Syed and Marar at Dayton Interventional Radiology for problems with my legs by my primary care physician. And in the course of trying to diagnose my back problems, this aneurysm was discovered.
If you had not seen Dr. Syed and you'd gone with maybe another type of surgeon, would they have had to do an extensive open you up kind of procedure?
I believe that would have been the case. And I didn't, that was too scary to me. I agreed to the operation after being assured by Dr. Syed that even though this was a large aneurysm, it was doable without opening me up in the conventional way, inserting a stent through the groin area, and thought that he would have great success. I was somewhat skeptical. Dr. Syed is a young-looking man, all right, and I went to another cardiologist and said, "What do you think?" And his comment was, "He has an excellent reputation."
What was your understanding of the procedure done?
I asked the questions because I wanted to know, number one, and number two, I was fearful. I have to admit that. And my questions were answered precisely, and then always followed up by, "Do you have more questions?" And I always did, but you know, those were answered too. So I was satisfied with that. I felt good. Now, nobody can give you a guarantee on anything, you know. And I wasn't looking for one because I knew the situation certainly wasn't going to offer me any guarantees. But I overcame that fear by having my questions answered precisely and succinctly. The results were almost immediate. I was only in the hospital for 1 day, and I was up and running by the afternoon of the second day. I mean, when I was walking, not running, but walking. I started to feel much better within about 3 weeks.
What were your limitations post-op?
Absolutely none. I mean, it was, you know, don't lift anything heavy, the normal things that you would recognize as on your own. But
and if you had not had treatment for this, what would have been the outcome?
The aneurysm was large enough that if it were to have burst, there would have been no saving me. You have the possibility of actually what I guess the term is bleeding out. So the outcome would have been I wouldn't be sitting here smiling at you talking. Yeah. they'd be saying, "He sure was a nice fellow." I became buddies with one of the radiologists at Good Samaritan, and he had had a stent placement, and during the course of having about 3 different scans with him, he commented, he said, "You know, I looked at your scan, and that is as fine a placement as I've ever saw." And I said, "Oh, come on." And he said, "No, I'm serious." And so that made me feel good too. So,
what has been the biggest change for you from before and after your procedure?
I'm looking forward to the next 65. I know that's impossible, but I feel a lot better. I feel like living. I feel like I am living. That's what I'm trying to say to you.